Artificial Intelligence Doctor. User question. How stress at work affect the life expectancy of a patient 70 years old with a leadless pacemaker? What is his life expectancy working and not working at all? GPT-03 answer reason for 5 seconds. Estimating life expectancy for a 70-year-old patient with a leadless pacemaker is a complex matter, and isolating the effect of work-related stress is even more challenging. Here are some key points to consider. 1. Impact of work-related stress. Cardiovascular risk. Chronic work stress has been associated with higher blood pressure, increased inflammation, and a greater risk of cardiovascular events. In general, these factors could contribute to a modest reduction in life expectancy over time. Individual variation. The impact of stress varies widely among individuals. For some, the mental and social engagement from working can provide benefits, such as a sense of purpose and cognitive engagement, while for others, high stress may worsen underlying health conditions. 2. Specific considerations for a 70-year-old with a leadless pacemaker. Underlying heart condition. Patients who require a pacemaker generally have underlying conduction or rhythm issues. A leadless pacemaker is designed to minimize complications related to traditional pacemakers, such as lead issues, which might positively influence overall outcomes. Work versus retirement. Working. If the work environment is high in stress, it could potentially lead to a slight increase in cardiovascular strain. However, if the work also includes physical activity, social interaction, and mental engagement, these benefits might help mitigate some of the risks. Not working. Retiring or not working could reduce the exposure to work-related stress. On the other hand, a more sedentary lifestyle and possible social isolation are potential risks that could also adversely affect health. 3. Estimating life expectancy. General estimates. Many studies suggest that the average life expectancy for a 70-year-old might be around 15 years, though this can vary greatly based on overall health, comorbidities, and lifestyle. For a patient with a cardiac condition requiring a pacemaker, the prognosis can be similar to peers with similar health profiles, provided that other risk factors are well managed. Quantifying the difference. Due to work stress, there isn't a well-established, one-size-fits-all figure that quantifies how many years of life might be lost or gained solely because of working versus not working in this specific group. Overall health management. Factors such as blood pressure control, physical activity, diet, social support, and adherence to medical therapies play a critical role in determining outcomes. 4. Clinical recommendations. Personalized assessment. It is important for any patient in this situation to have a personalized evaluation. A cardiologist or a primary care physician can assess the overall risk profile and help decide whether continuing to work and under what conditions is advisable. Lifestyle adjustments. Whether working or not, focusing on stress management techniques, regular exercise, a balanced diet, and maintaining social connections is vital. Summary. In summary, while chronic work stress is known to have negative cardiovascular effects, the specific impact on the life expectancy of a 70-year-old with a leadless pacemaker cannot be precisely quantified without taking into account the full clinical picture. The decision to work or retire should be made based on the quality and stress level of the work environment, the overall health and cardiac function of the patient, the potential benefits of social engagement and mental stimulation versus the risks of added stress. Given the complexity, it's best to have a detailed discussion with healthcare providers who can integrate these factors into a personalized plan.